But we're here to talk about healthcare. And really, it's an interesting time, as we all know. If you just turn on the radio, the presidential election, certainly, healthcare is the key issue of conversation. Although over the past couple days, talk about political incorrectness. I mean, this is unbelievable what this congressman running for the U.S. Senate said on the airwaves. But when you get to the issues, the economy, a key issue, certainly the wars to a certain extent, certainly related to the economy, jobs, but healthcare is right there. And you think about it, it has to be there. And you look at what has happened to healthcare in the United States, the status quo is unacceptable. And whether you're pro-President Obama or pro-candidate Romney, whether you're pro the Obamacare plan or whether you're against the Obamacare plan, something needed to change and something continues to need to change. And I'd like to give you a couple key points. One, as I said, the status quo is unacceptable. The U.S. spends more than any other country for health care. $2.6 trillion, that's $8,400 per person. That's double the other most developed countries in the world. Our quality is inconsistent. We're rated as the 8th lowest life expectancy around the world. 51 million people, and growing, prior to the implementation of healthcare reform and all that it will bring with it, 51 million people uninsured. And 80% of them come from working families. The number of people who are obese in the Commonwealth of Pennsylvania has grown by 230% in the last 9 years. Think what that does to life expectancy. The aging population, certainly the debate about Congressman Ryan becoming the vice presidential candidate for Romney, the debate about Medicare, and I hope in the Q&A we can get into that a little bit, but it really has to be solved. It can't continue as is. We need to find a way to make it work for older citizens, but doing it in a way that's financially viable. So in the face of all this, and when you look at overall GDP, gross domestic product, I think we're roughly 18% of GDP is dedicated to healthcare today. And unchecked, by the year 2025, it will be 25% of GDP. We've got to do something about it. So in this time of great challenge, I don't mean to put anybody in a sad mood here, there is opportunity. And I have to say, the Obama plan, the Affordable Care Act, is a starting point. Because what it does, it looks at those 51 million Americans who do not have insurance and says, here's an opportunity for you to gain access. Those who are Medicaid eligible, and the level as against poverty level, the level of eligibles will go up. So those folks and their families will be able to access care through Medicaid managed care programs run through their states, and in large part funded a combination of the state and federal government. And then others who fall above the poverty line and have traditionally been shut out because they're running their own business and they can't afford it, they're young, they're healthy, why do I need insurance? How do they access care? They access care in the emergency room. Well, now they'll be able to buy coverage either through a public exchange, and if they meet certain requirements, they will get a subsidy to be part of that public exchange. Or they can acquire it, as many of you will be able to do, through your small businesses to acquire individual programs or develop a coalition and purchase through a private exchange. So you're going to have plenty of opportunities. And I don't see this as a competition here. I can guarantee you the players in Pennsylvania, Independence Blue Cross, the other blue plans, United, and Aetna are doing everything in our power to make sure that we have products that meet your needs. Obviously, I'm biased and I'd like to see you with Independence Blue Cross, but you should rest assured that these three organizations and others are working tirelessly to make sure they have products that will work on the exchange, are developing partnerships, develop private exchanges, are developing individual products so you can go online or call a representative and really have a plan that works for you. So that's all good news. So let's talk about what IBC is doing in light of this. And just to give you a quick background for the last couple of years, we had a couple of very difficult years. There was a time, many of you may know, we tried a merger between Independence Blue Cross and Highmark Blue Cross. The merger did not happen. We had put all of our eggs in that basket. So from a strategic point of view, we had to start all over. We had to back up and say, okay, we want to be an independent and strong Blue plan. Today, I'm thankful to say that we are from a revenue perspective, we're the 4th largest Blue in the country and growing. We've had significant growth in most of our sectors, not all. These guys are pretty good at some of those sectors, but for the most part, we've had growth in our membership across the board, and we're developing new programs to really meet the needs of the populations we serve. And as business leaders, as family members, you need to be thinking about some of these as you make decisions about your products. So just to cite a few that we're focused on at Independence Blue Cross. The first one is we believe that technology is a key, that the physician, the hospital, the insurer, the individual member or patient should have access to real-time quality data that tells a story about their conditions or multiple conditions, or just about how they can move to a more healthy lifestyle. We're investing, as our competitors are, significantly in building not only the technology, but the connectivity around the healthcare system to ensure that when you walk into a doctor's office or you make contact with any point within the system, you have an opportunity to have the story right before that clinician and have an understanding of what you need to do, whether it's follow-up visits, tests, certain types of dietary issues, that you're able to address those in a way that keeps you as healthy as possible. So that's something that's exciting. And how we've done that, we've created relationships with the primary care physician community. We have over 1,300 physicians throughout our network who are part of our patient-centered medical home program. And frankly, it's really exciting because you look at, as we bring more physicians into that, it means that more percentage of our population have the ability to access what a patient-centered medical home means. So 35% of our membership now has access through their primary physicians to a patient-centered medical home. What it means is if you need to see a doctor, you pick up the phone, you can get in that day. If you need to have a follow-up visit, you're going to get a call from that physician's office, and you're going to be reminded of that. You get a reminder about, are you taking your prescription? You get a reminder of healthy lifestyle tips. And it's something that we are very focused on, making sure through our Healthy Lifestyles program that you have access to that. These are all good things, and what they do when followed, when keeping individual patients, populations of patients connected to their primary care physician, to their point of contact of the healthcare system, you have a better opportunity to keep them healthy and drive down costs. No longer will folks feel a need to go to an emergency room when their care is maintained. And then obviously those who truly need emergency rooms, the access to care will be there for them.